Good morning. It's Monday, March 23rd, and I'm joined by the president of Local 2180, Daryl Roberts. First and foremost, we want to thank you for being on the front lines of service delivery. Now more than ever, the public is counting on all of us to be there for them during this pandemic. They're watching our every move, and we must lead by example. Thank you for your continued professionalism. We have entered uncharted waters for all of us who are first responders, and we're dealing with the changing COVID-19 issue every day. To that end, there are some things we can improve on. For example, we sent out information related to COVID-19. We sent out CDC guidelines. We sent out the risk exposure chart. We've asked Dr. Farrer to speak with you at stations to give her perspective from a clinical point of view. We sent out PPE and we provided new bags to make the PPE readily accessible. And we've taken an inventory of our PPE cache, and we have thousands of masks, gloves, and gowns. We equipped you with PPE for patient contacts, but we didn't focus on community contacts within the firehouse, apparatus, or elsewhere at work. What we can improve upon is to prepare you for community transmission of COVID-19. When I say community transmission, I'm talking about our fire station community where we live. Right now, we aren't seeing our personnel being exposed to test positive COVID-19 patients or patients with symptoms. We are seeing potential exposures from our own employees who didn't know they were going to be sick with the virus or show signs of it. We fully understand the stress this can cause when our employees share the same space as those who either present symptoms at a later time or eventually test positive. For this reason, we are implementing the social distancing rule at all fire stations. This morning, I consulted with our medical director, Dr. Farrer, and out of an abundance of caution, from this point forward, all personnel are directed to maintain 6 feet of separation from one another. When this is not possible, all personnel are directed to wear a surgical face mask. We understand this is not normal, but it is and will be the new normal for the time being. Wearing the mask isn't to keep you safe. It is to ensure the safety of those around you. This means the dinner table is going to look different, the TV room will look different, driving in the apparatus might look different, and grocery shopping might look different too. Once again, this is the new normal. We also understand the anxiety for some of our members who may not feel safe going home from work. To help with that, we are providing housing at any of our stations that have extra dorms. Fire Station 1, 7, and 8 all have extra dorms, and effective immediately, you are welcome to stay there if you wish. Remember, this is for employees who are asymptomatic, and all social distancing guidelines will apply. Once Station 10 is operational by mid-April, we will commit Station 10 for the same purpose. We ask that you use the chain of command and request housing through the EOC Logistics Branch by using Form 213. Remember, use social distancing of at least 6 feet. If you can't maintain 6 feet, wear a surgical mask and reuse it when you can. Don't be afraid to remind someone of the new normal. It's not rude, it's polite, and it's the right thing to do. Before I introduce our president of Local 2180, I want to thank Daryl for his consistent leadership on this issue. He and I have been working collaboratively on all the issues, and we're communicating on a near daily basis. And now, President Daryl Roberts.
Good morning, brothers and sisters. These are unprecedented times, and you guys are on the front lines and center stage in this ever-evolving pandemic. The community is depending on us to respond with professionalism and courage, as we always have. Our brothers and sisters are depending on us, but most importantly, our families are depending on us to get home safely. Your union is working for you. Earlier this month, we attended the IFF's COVID-19 medical briefing in Washington, D.C. We have worked collaboratively with management and city staff to ensure we are doing everything in our power to protect our community and our members. We will continue to push out timely information and update on our social media platforms, union website, and handouts at our fire stations. It's critical that every member completes the assigned Target Solutions assignment. Please continue to review the IFF and CDC websites. We will continue to work and advocate on behalf of you and your family. Lastly, I want to ensure all of us are taking a second to evaluate our stress and anxiety levels. These are challenging and unprecedented times for us and our families. Behavioral health resources are readily available. Please reach out to an IFF peer support member if needed. Please take care of yourself, your brothers and sisters, and our community. Our families are depending on it. Thank you.